Hi, I'm Alan Kaplan, and I'm here at the Jacob Javits Center in New York City for Prime Care. And we have just addressed a group of primary care physicians, internists and pediatricians, to tell them about hereditary angioedema, a disease that we know an awful lot about and can now treat in ways that we were unable to do in prior years, and we're trying to increase awareness so that patients are properly diagnosed and treated appropriately by these physicians, or at least a referral made to people who specialize in the treatment of the disorder, such as allergists and immunologists. Dr. Michael Frank and Mark Rydell and I have done this sort of program together in many areas of the country. And we tend to synergize pretty well, I think, with Dr. Frank giving introductory remarks and describing the clinical manifestations of the disease. And then I speak to the pathogenesis of the disease, that is, the mechanism by which the swelling actually occurs. And both Dr. Rydell and I talk about therapy for the disease. I introduce it and talk about the agents that have been available to us for the past 10 or 20 years. And he talks about new approaches which we think will revolutionize treatment of the disease, because they are now targeted to the mechanisms involved in the formation of swelling, which were not approachable previously. The older therapies were by comparison non-specific, although they did work, the caveat being that therapy has to be lifelong, and there are side effects with the prior agents that were used, many of which are obviated by the newer approaches. I think that primary care physicians actually see a lot of angioedema, and the distinction between what we might consider ordinary angioedema that is frequently seen from hereditary angioedema, which is a particularly severe form of angioedema that is potentially fatal and often leads to emergency room visits or hospitalization, is really very important. I think that we've been successful thus far in educating people and increasing awareness of this disease, and we hope that the interval in diagnosing the disease will gradually decrease. In years gone by, people with hereditary angioedema could go 10 or 20 years without a specific diagnosis. The last study showed an improvement, but it was still about 6 or 7 years on average before an appropriate diagnosis was made. Truth be told, by the time the person is seen with a second attack of angioedema, the diagnosis should be made, assuming that during the first episode, the appropriate laboratory studies are done so that the diagnosis becomes obvious. And that's basically the most important part of what we are doing, is increasing awareness so that the diagnosis is made expeditiously and the person can be appropriately treated.